So we have a huge problem here in San Francisco and elsewhere with substance use disorder and with people who are overdosing and all too often dying. We know that overdose deaths have been going up here in San Francisco. This is a public health crisis. And what we also know is that the war on drugs failed, and criminalizing addiction is not effective. In fact, it makes the problem worse. And we need to treat drug use as the public health issue that it is. It is a health issue, not a criminal issue, and we need to stop using the criminal justice system as a way of somehow addressing addiction in our community. The other piece of it is that people who are using drugs, including people who are injecting, and particularly people who are injecting outdoors on our sidewalks, in our parks, by people's homes, by people's businesses, are going to do so even if we castigate them and tell them not to do it. It's not about ordering people to stop being addicted or to stop using. It's about meeting people where they are and giving people options to be healthy, and we hope to move into recovery. And safe injection sites, which are now illegal under state law, and what we're going to do is to remove the state barrier so that San Francisco, Oakland, and hopefully other cities can implement a pilot program. Safe injection sites are facilities where people can go inside into a clean, healthy, safe setting with medical personnel, with experts there to help them, to make sure that they have clean needles, to make sure that they have access to services and recovery programs, and to really improve conditions on our streets, and to make sure that people who are using drugs can do so in a healthy way. Although safe injection sites have been sort of controversial and a big fight here in the U.S., they aren't in other places. They have been in existence for a while in Europe, in Canada, in Australia, and the data is clear. Wherever they are implemented, overdose deaths go down, infections, whether HIV or hepatitis, go down, crime in the surrounding area goes down, syringe litter goes down. It's incredibly, and most people end up going into recovery because you can get people there with social workers and healthcare workers to help them. I think sometimes people have an immediate reaction, oh my God, if you put a safe injection site in my community, it's going to somehow make things worse or more problematic. But the reality is people are already doing this. And the question for the public is, would you prefer that people use drugs or inject on the sidewalks, by your home, by your business, in the park that you're using? Or would you rather they do so inside in a supervised, safe, clean environment? And I think most people would prefer the latter, and the latter is what makes sense. So we will be introducing this bill when the legislature reconvenes. We already have a very broad coalition behind the bill. This bill has already passed the legislature. We put it on Governor Brown's desk in 2018, and sadly he vetoed it, and so we will be taking another run at it. This is an important public health measure that will save lives. So I now want to invite up someone who has been a longtime, strong, and staunch advocate for this public health approach to addiction, the mayor of San Francisco, London Breed.
Thank you, Senator Wiener, and thank you all so much for joining us here today to really talk about the need to ensure that here in San Francisco we provide a safe injection site, and we provide it now. I really want to just appreciate Senator Wiener for his advocacy, but also the fact that he is not giving up on this fight. He understands the importance. He understands that this is about saving and changing lives for the better. You know, when you have people that you know and you love who struggle with addiction, the thing that you want most for them is you want a better life for them. You want them to be able to get help. You want to make sure that that addiction doesn't take their life. And that's happened to me. Many of you know I talk about what happened to my sister, and I wish the opportunity to get help was available to her. And the fact is, we're not just talking about people who are struggling with addiction as it relates to syringe use. There are so many people who are dying on our streets from using so many other drugs, crystal meth, methamphetamine, people who are using fentanyl and other drugs. When you think about the number of deaths that are on the rise because of overdoses, what that means is we have to do a better job to understand that we can't control people and their addiction. But what we can do is be there for them. And this is a way of being there for people. This is a way of providing a space that doesn't judge them. So when they walk through the doors, they're not treated like a drug addict. They're treated like a human being. And they know when that one day comes, when they say, I need help, that person in that safe injection site says, I got you. That's what this is about. I got you. And we're going to help you. Because what we're doing right now is not working. Of course, as mayor, you want clean streets. You want people to have a good life. You want people who are homeless to be housed. You want everyone to have incredible opportunities that such an amazing city has to offer. But there is no one size fits all. People have challenges. People have struggles. People come from all walks of life who use drugs in this city and specifically in this community. And you know what breaks my heart the most is to see it and to see people walking by with their baby strollers, with their kids, who think that this is normal. This is not normal, but it's not going to go away because we don't want to see it. And so these safe injection sites are really a way to make sure that we provide a space, that it's safe, that it leads to a better opportunity when the person says, I'm ready. And so again, I want to thank Senator Scott Wiener because his leadership has been unwavering. And I want to also admit, you know, I was a little uncomfortable about this conversation early on when I was on the Board of Supervisors. And Laura Thomas, who was working with the drug policy group, you know, opened my eyes to what this could actually mean for people. Taking a trip to Vancouver to see it firsthand, looking at the data that there were 0 drug overdoses in this facility since this place is opened. Looking at the changes and the clean streets and some of the things that have been implemented. That's what I want here in San Francisco. And why not give it a try? Because what we're doing right now is not working. And we can't be afraid of something that could help make a difference. That's why we're here. That's why we support this. And that's why we want to see it done. And that's why Senator Scott Wiener is not giving up. We have some incredible people who really care about getting us to a better place. And I'm really grateful that so many of them have joined us here today. And right now, I want to introduce a strong supporter of safe injection sites, our Director of the Department of Public Health, Dr. Grant Colfax.
Well, good morning. Thank you, Mayor Breed and Senator Wiener, for being champions of this critical public health intervention that we know saves lives and opens key pathways for treatment and support. The evidence is clear, and the need for this key public health intervention has never been greater. Overdose deaths in our city rose 70% in 2019. And unfortunately, all signs point to this trend continuing in 2020. We can blame the powerful opioid fentanyl for these dramatic increases. Fentanyl overdoses, however, can be reversed with naloxone when someone is nearby to administer it right away. Fentanyl overdoses can be prevented when people test the potency of their drugs before using them. Lives will be saved with safe injection sites, also known as safe consumption sites, in San Francisco. These life-saving interventions are the most important thing we can do at safe injection sites, but they are not the only thing. Research shows that safe injection sites improve the health of people who use drugs. They increase access to treatment. They decrease public drug use. They prevent infectious diseases, and they link people to care, including medical services and housing. And here are a few things that safe injection sites do not do. Research shows, the data, science, and facts show that safe injection sites do not increase drug injection, drug trafficking, or crime. We are in an emergency in San Francisco, and this is not an emergency related to COVID-19. This is an emergency related to drug use and overdose deaths. We lost 441 people to overdose last year. We have some of the best behavioral health treatment in the world for people in our city, but we must do more. We need every tool at our disposal. Today's announcement is critical to moving that tool forward, and I'm glad we could come together. And now, I'd like to introduce Joe Hollandoner from the San Francisco AIDS Foundation. Thank you.
Thank you, Director Colfax, and allow me to start by thanking Senator Scott Wiener as well as Mayor Breed for being champions of what I believe is the public's will. A majority of San Franciscans support safe injection facilities, and these two elected officials are working tirelessly to make sure that they become a reality, and I could not be more thankful. At San Francisco AIDS Foundation, we love drug users. And we believe that drug misuse should be treated as a behavioral health issue, not a criminal justice one. Our mission of health justice for all leads us to want to champion these centers to ensure that we actually can achieve the ambitious goal of getting to zero. We know that drug overdose is a leading cause of death for people living with HIV, and it's completely preventable. It also aligns with our work around racial justice because Black lives matter, and we know that Black lives are disproportionately impacted by drug overdose, and this is completely preventable. We must pass this evidence-based practice as a best practice for San Francisco because it has been proven elsewhere to be effective and successful. And San Francisco AIDS Foundation stands ready to make these a reality with our partners as well as everyone at the San Francisco Department of Public Health. And while I'm grateful for our local leadership at the state and the city level, we also must recognize that a significant barrier to our organizations providing safe injection facilities is the White House's current administration. Until there is a sea change in the administration at the federal level, we are at risk as an organization to provide these services. So I encourage everyone to get out and vote. And with that, I would like to introduce my good partner in this work, Vitka from Health Rate 360.
Hi, my name is Vitka Eisen. I'm the CEO for Health Rate 360. And I'm also representing CADP, which is the State Association of Substance Use Treatment Providers. And we support this legislation, and we have supported it since its very first baby steps. I'm also a former injection heroin user, and I found recovery through the safety net programs here in San Francisco, Haight-Ashbury Free Clinic. We've continued to support this legislation because although we know treatment works, treatment is really effective for substance use. It's really effective. But it isn't effective for everybody at the same time. And unfortunately, many people die before they ever get to go there. They die of an overdose before they have the opportunity for recovery. Now that is tragic to me. It's tragic because it's completely preventable. We need to pass this legislation and do common sense approach, public health approach, to caring for the most marginalized, most vulnerable people. We have been doing the same things really well for the past number of decades. It is time to do something completely different to reach the people we have not reached yet. Many people think, they hear about this, they have a similar reaction to many people hear it at first, and they think, why would we make it easy for people to use drugs? Aren't we supposed to help them hit bottom? I mean, that's his whole thinking around people have to hit bottom. And I have to tell you, having done this work for a really long time, the only bottom is really death. That's a bottom from which you cannot come back. People on our streets are living in a great deal of pain and misery and despair. You cannot make them more despairing. You cannot shame people into recovery. What gets people into recovery and health is hope. It's hope and personal connection. And supervised consumption sites provide connection and hope to people who have none. And through that connection, that early, like somebody believes in you and they trust you, can move people one more step to health. This is policy that makes sense. This is policy that is care-based, that undoes some of the damages of the drug war. We tried to lock everybody up. California had the highest incarceration rate, third highest incarceration rate in the world, mostly black and brown people. It was not effective. It didn't end the substance use epidemic, the opioid epidemic. It didn't do that at all. More people are dying today. More people have died in San Francisco than of overdoses in the last 7 months that have died from COVID-19, where people have died from overdoses. I had the good fortune of being on then Supervisor Breed's task force that looked at supervised consumption. And I have to say, she was pretty prescient, because in those days, we had about 22, was double digits people who died of overdoses. Double digits. And now, it's on pace to exceed the 440 of last year. So we knew it was coming. We just need the law to catch up with us, because we are ready. We who work in the community, we are ready, and we want to help. So please, please become engaged and see that this time, fourth time's a charm, this time the legislation will pass. So thank you, Senator Wiener and Mayor Breed, for supporting these efforts.
Thank you to all of our speakers. Now we're happy to answer a few questions from the press, if there are any. Yes?
Yes, I'm wondering if anybody has heard from Vice President Biden whether he would be inclined to support this should he be elected.
The question is whether Joe Biden has taken a position on this issue. I'm unaware. of him taking a position on the issue. At this point, this is really about removing the state barriers. And we know that the Trump administration has attempted to crack down on Philadelphia's safe injection site, and Philadelphia won in court. That is on appeal right now, and we're watching that very closely. So, our hope is that with a change in administration, we might see a more enlightened approach. But we are very focused on removing the state barrier, which is a big obstacle right now. Yep.
Hi, Erica Sandberg, City Journal. Crime reduction has been the norm in San Francisco for many years. We have seen an incredible surge in drug users on the street in the worst conditions possible, worsening every day, and higher rates of overdose. What makes you think that doing this, going further into harm reduction policy, is going to have a guaranteed result?
So what we have is a lot of data from other countries, including Canada and Europe and Australia, where they have used these sites, and it has had beneficial impacts with many people going into recovery as a result. Fewer overdoses, fewer injections, less syringe litter, and so it's worked where it's been tried. And so our approach is let's authorize a pilot program so that San Francisco, Oakland, and perhaps other cities can try it out, and we will see how it works. And we are optimistic that it'll work well, given the experience in other countries. And I think the mayor really hit the nail on the head, and I'll say it again to the people of San Francisco, is in terms of substance use and injecting, et cetera, how is that going now? It's not going so well, and so let's try this proven approach, and I'm optimistic that it'll make things better. Is it a silver bullet? Of course not. There is no such thing. This is a major public health crisis, but this is a strategy that we know can work, and we're optimistic will work. Other questions? Yes?
Bill with KCBS. Jerry Brown vetoed this. Is there any indication that Governor Newsom will sign it?
So the question is that Jerry Brown vetoed it. Is there any indication one way or the other whether Governor Newsom will sign it? I want to be clear, I do not speak for the governor, and the governor has not said definitively whether he would sign it, and I wouldn't expect him to do that ahead of time. The governor last year did make positive public comments about safe injection sites, and so that gives us hope that we can make the case to him that this is a bill that he should sign, and we will, as we always do, engage the administration, and on this one we want to engage him as early as possible and work with him. Any other questions? Okay, wonderful. Again, I want to thank our entire coalition, including the Drug Policy Alliance, and thank Mayor Breed. And I'm sorry that Mayor Schaaf got stuck on the bridge, but she's with us in spirit. Thank you very much, everyone.